On standby for a few minutes. All right, it's time for our Health Watch, and as always, we are joined by our friend Dr. Syed Hussain of Trinity Health of New England. Good morning.
Morning, Symphony.
Now, we are prepared to tackle some interesting topics. We're going to save the best for last. But first up, this one's pretty serious. The WHO says there are some drug-resistant superbugs that are really just starting to spread out there.
Yeah, this is a report that the World Health Organization, Symphony, came out earlier this week, looking at data from 2023, but basically shows 1 in 6 lab-confirmed bacterial infections are drug-resistant. So what that means is that we're running out of tools in our arsenal, in our toolbox, in terms of antibiotics that can act against these bugs, bacteria. So they looked at 8 common bacteria that can cause urinary tract infections, GI infections, other types of infections in the body, and 22 common antibiotics that are usually prescribed. This is a growing concern. The rate of antimicrobial resistance or resistance to commonly used antibiotics is increasing globally. Where we saw most increase was in countries with poorer health systems, fewer resources, less surveillance. But also in this country, in the U.S., the CDC also came out with a report that indicates a dramatic rise over the last several years in drug-resistant bugs.
So what should people do or
Great question.
do?
So in terms of individual, what you need to do, practice hygiene, the basics that we've always taught and spoken about, and then make sure you get your vaccination. Make sure you complete your antibiotic course if you've been prescribed. Even when you start feeling better, it's important you complete that course. And then on a larger scale, we need more funding for newer treatment modalities, new antibiotics, diagnostic tools, more surveillance. So there needs to be a concerted effort globally, nationally, statewide, and then, of course, we all have to do our part in terms of staying healthy.
Yes, yes. Okay, now with it being Breast Cancer Awareness Month, we do want to remind folks to go out and get their examinations. And this is something that also affects men. I think oftentimes people think, it's women who need to make sure they get their mammograms, but men can also get cases, right?
That's right. And so October is Breast Cancer Awareness Month. It's symbolized by a little pink ribbon, which basically denotes solidarity with cancer patients, breast cancer patients. Mm-hmm. But important things to remember, this is the leading cause of cancer in women in the U.S. if you exclude skin cancers. Okay. And the second leading cause of cancer death in women after lung cancer. While the good news is that mortality or death from breast cancer has steadily gone down over several decades because of screening mammograms, because of newer treatment modalities, we still need to make sure that folks understand if you're 40 and above, most large medical organizations now recommend 40 and above women to get, at average risk, to get a screening mammogram. Also know what the risk factors are, what red flags you need to look out for. Make sure you have your appointment with your primary care doc so you can discuss all of these things, and especially whether you're average risk or higher risk based on certain characteristics. All things to keep in mind.
All right, and I said we would save the best for last. Best as in it might make you giggle today. There is some research out there that says using your phone while you are on the toilet, everybody does it, increases your risk of hemorrhoids.
That's right.
All right, Doc.
So let's talk a little bit about this. Now, to your point, most people are guilty of doing this, right? So this study, small study, 125 participants who were undergoing a screening colonoscopy were actually asked to fill out a survey, a questionnaire saying, okay, do you use your smartphone on the toilet seat? And 2/3 of them said yes. And in that group, there's a 46% higher risk of developing hemorrhoids. Now, let me explain why this may be happening. Because when you're sitting on the toilet seat with your phone, chances are you're going to be there longer, not just 2 to 3 minutes in and out. So that means the rectum, which is because of how the mechanics of the toilet seat are, it's pulled downwards. There's more pressure. To compare, for instance, sitting on a regular seat, right? And so that leads to pooling of blood in veins that can cause increased pressure that can lead to hemorrhoids. And the manifestations will be pain, bleeding, itchiness, discomfort, basically. So long story short, keep those smartphones away. Go to the toilet 3 to 5 minutes, not longer than that, and make sure that we take steps to prevent hemorrhoids.
All right. Thank you so much for joining us,
Sure,
Doc.
absolutely.